terms of patient selection, as with any aesthetic procedure, mild to moderate is your sweet spot. Anyone too severe, that's pretty much surgery. If I did one face with PDRN and the other face with exosomes, am I going to be able to tell the difference? Probably not. And that's the problem. A lot of this is qualitative and not quantitative. You can't put a number on it. This is about aesthetics for the male genitals, whether it's the penis or scrotum. We can enlarge these, so it's a way to really enhance them, to give them a little bit more confidence. We can use tox and fillers to do all sorts of magic. I still buy a lot of HA and Radiesse because those are my key ingredients for penile augmentation.
Welcome to Inside Aesthetics, the world's leading podcast for cosmetic practitioners and business owners.
Our podcasts are aimed at medical professionals and should not be used to make medical, legal, or financial decisions. You should get an appropriately tailored piece of advice from a professional in your country.
To show your support and stay up to date with our latest episodes, click the follow button if you're listening on Apple Podcasts or Spotify. And if you're watching our episodes on YouTube, hit the subscribe button as well as the bell icon.
If you're interested in joining our online community, being a guest on the podcast, or would like to work with us, all of our contact details are in the show notes. And now, let's jump into today's episode.
Hey guys, welcome to another episode of Inside Aesthetics, the world's leading podcast for injectors and cosmetic businesses. Now, we're back to Injector Diaries.
We're joined by a friend and colleague from Canada, and we actually met John, who we'll introduce in a moment, but during our travels during the CAMA Expo late last year. But also, John, you're a member of our Patreon community, so I guess we kind of know each other through that a little bit as well. So, you know, when Jake and I were in Canada, we saw a lot of, I guess, similarities in some ways in terms of the way that we approach aesthetics, and it was really interesting getting to meet our friends and colleagues over there. But it'd be great to get an insight into the Canadian market. You know, potentially we can highlight some differences between what we do here and what you guys do there, and also dive into your story, John, because you've got a really interesting background, you've got a really interesting area of aesthetics that you focus on, and we'll dive into that in a little bit more. Yeah,
and just before we introduce John, a little reminder about our new app called IA Community. It's launching imminently, and I reckon in the next 4 to 6 weeks. Mm-hmm. So look out for that. There'll be a link at the bottom of the podcast description to add yourself to the waitlist. What is the app all about for people who haven't heard about it?
Well, I mean, the genesis of the app was to create a better home for our Patreon subscribers and that community, but we've grown it into something that's much more than that. So it's essentially a global community app that has a lot of cool features like a central conference diary, you know, people being able to share their before and after photos in a compliant way, as well as all of the abilities to talk in real time with colleagues and companies from all different parts of the world.
Yeah, I like to think of it as a social media app for injectors, really, as well as nurses, doctors, dentists, and everyone else who works in that industry. So check it out, guys. Right, now let's introduce John. Thank you for joining us this morning from Toronto. What time is it there?
It is a little bit after 6 p.m.
Fantastic. So you've been working hard today. Now, tell our audience about yourself, because you've got an interesting background. You weren't always doing aesthetics, so how did you fall into this?
Oh, it was pretty convoluted, and I didn't even think I was going to be a doctor at one point, especially like 30 years ago. The funny thing is, I had finished university, and I was actually a nightclub DJ, and I was into the club scene, and I finished with an engineering science degree with a focus on electrical engineering and a fine arts minor, and I had no idea what I wanted to do with my life. I was living in Baltimore, and I moved to New York City, not for any kind of educational aspirations, but because of the nightlife. And then I decided, you know what, I need to, do something with my life. And my dad was an engineer, and I did what he did, and my mom's a pediatrician. She's retired now. I was like, all right, let me try this doctor thing, because I love science, and I love the application of science in medicine and the interpersonal skills that go along with that. And I thought I was going to be an internist or a family doctor. And when I rotated through my final year of medical school, I really loved being in the OR, right? And I thought, okay, I'm going to be a surgeon. I'm going to be OBGYN. I'm going to be a urologist. And then one of the last rotations was actually anesthesiology. And I was like, I love this because I can participate in all sorts of different surgeries. And I'm kind of behind the screens, and it's technical, and I've got all my gadgets and things like that. So that's what I went into. And for about 8 years, I was practicing in New York City and New Jersey, working with plastic surgeons, in GI suites, also doing orthopedic cases, a variety of ambulatory cases. And at that point, I still had no idea I was going to be an aesthetic doctor, but I was always artsy, right? Whether it's music or visual arts. I relocated to Toronto in 2013 because my husband and I had twins, and we just didn't feel like raising them in New York City, right? And we wanted, to move somewhere that was a little bit more affordable. And we had visited Toronto a few times, and I had absolutely no connection to Canada. And there was a job listing for chronic pain. And it was actually the best offer on the table because I looked at all the anesthesia positions in the United States, and this was the best offer on the table, such that I uprooted the family and we moved to Toronto, and I'm still working in that pain management position. But it was 2014 that I asked the clinic owner if we could take on a PRP device, because as early as 2007, we were working with orthopedic surgeons working with PRP. So we took that on, and we were one of the first clinics to do that. We weren't the first, and we were treating musculoskeletal injuries. And then I found out, there are other applications like regenerating hair and treating erectile dysfunction. And that's when I came across Dr. Charles Runnels, the inventor of the vampire procedures, the vampire facial, the P-shot, the O-shot. And I was Ontario's first provider trained by Dr. Runnels. And the doors just opened the way they did from there. And I was like, well, if I'm injecting and I'm doing aesthetics, then I need to learn more about Botox and fillers. And took some courses, and it just kind of snowballed to where it is now.
Okay. Quite an interesting background. It's always, fun having these conversations because everyone comes from some kind of weird background because, the industry is relatively new. So, we're only sort of now seeing the first generation of people that have set out to be aesthetic providers, other than plastics, I guess. So it's kind of interesting hearing the backstory and how you sort of ended up where you're at. So when you went from America to Canada, did you have to do any kind of extra education, or was your medical registration immediately transferable across the border?
It was transferable, but it wasn't one-to-one because I wasn't going from OR anesthesiology to OR anesthesiology. It was a different specialization in terms of pain management. So my approval was kind of dual for initial and then also for pain management. And it was restricted to pain management at the time. And then as of like the last couple years or so, there's reciprocity with the United States, so I don't think it's listed as restricted anymore. But during that time, I was able to expand my scope of practice to aesthetic medicine and other things.
And when you did your training with Dr. Charles Runnels and you learned about PRP, some of those treatments are, let's call them medical, so treating erectile dysfunction, for example, and some of them are aesthetic. So was there a particular day or patient or moment where you thought, you know what, there's this whole different world out there of aesthetics rather than just treating ill people? And what excited you about that?
Well, during the training, I think at that point I hadn't really injected filler yet. And I did my first vampire facial, which was basically using one syringe of HA and then just chasing over top of it with PRP. And there was this one gentleman, he was like my first case, and he looked fantastic afterwards. It was just like, it just had this wow factor. But like, he was one of the trainees as well, and I couldn't follow up with him or anything, but he just looked fantastic, and he got lots of compliments there, and I was like, I'm onto something here.
PRP is, as you said, it's not new, it's been around for a while. We tend to have quite a divided community in terms of the opinions on how effective it is and being able to give predictable results. What are your sort of insights that you've learned over your time using it in terms of how to get more predictable results and how to, I guess, select the right patients?
So in terms of patient selection, as with any aesthetic procedure, mild to moderate is your sweet spot. Anyone too severe, that's pretty much surgery, right? But in terms of PRP, I'm pretty old school in terms of the device that I use. It was double spin. And you get a much better platelet yield and concentration with double spin. It's more expensive than the single spin devices, but the single spin devices are cheap and they're ubiquitous. So just about every clinic has a single spin device. If you compare blood draws, Single spin devices are typically about 20 cc's. For PRP with my devices, it was either 30 cc's or 60 cc's. And then I have a system where I'm actually using a 120 cc blood draw, and I use that for hair regrowth. And I only do that in one session. All right, it is a one and done approach. I don't do a series of 3. So any device or centrifuge or company that's trying to sell me a series of 3, I'm automatically turned off because I can do this with just one treatment. And patients have come back after a year, 2 years, even 3 years where their hair is still denser than baseline. So if you think about it, like the platelets, that's a business end of therapy. It has all the growth factors. So if I'm delivering in one session, platelets in high concentration from a 120 cc blood draw, and you compare that with a 20 cc blood draw, there's no comparison. I'm delivering more therapy. And then another thing is with single spin systems, sometimes the yield is inconsistent, right? And the definition of PRP, it changes all the time, but maybe about like 8 years ago, I think the orthopod said that, you really need a platelet content of 500 platelets per microliter, for angiogenesis and tissue regeneration. And sometimes your single spin systems achieve that, sometimes not. But the double spin systems are typically so much higher that they're always achieving that threshold. And then all of a sudden there's PRF, the next generation of PRP. And, I was never impressed with that either, just because if you look at the numbers, my double spin system always had higher platelet concentration and yields than PRF, looking at their numbers. When I guess providers talk about PRP, they all say it's just one thing. And if you're a company, you're always comparing yourself to single spin PRP because the numbers are terrible. And sometimes you're actually delivering fewer platelets than whole blood, and you're actually delivering platelet poor plasma. So it's an easy win if you want to compare yourself to PRP. However, if you're comparing yourself to double spin PRP, double spin is usually going to be a lot better.
Right.
We've gone way
way
into the technicalities. We're trying to get to know John.
Yeah.
All right. So I'm going to wheel us back
But
to...
that's the way the conversations go sometimes.
That's the way David's brain works.
Yes.
Okay, so let's, I guess, come back to Canadian aesthetics before we get into your why. So tell us about what people in Canada want. Are they similar to Australia? You've just been to Australia. You've seen Australian aesthetics. Are all the products available? Are people willing to spend money, or are they more conservative? Just give us an insight.
So it really depends on the neighborhood, I think. I just moved from Etobicoke. It's kind of in the suburbs of Toronto to downtown Toronto. And everyone wants to look natural. Everyone wants to look like a better version of themselves. And most people are terrified about looking like an alien, right? So that's something that we have in common. It's just that in Etobicoke, it just felt like sometimes the patients would really haggle. It's like, all right, to really get this polished look, I'm recommending about 3 to 5 syringes, and they only want 1 or 2. All right. However, now in downtown Toronto, I have a different clientele. Like, I don't care. Just do what you want, whether it's 5 cc's, 10 cc's. I was like, I love this. This is great, yeah. Right? Because now I can do my magic and without the limitations. But I'm always respecting a budget. And I always want to try to do as much as I can with as little as possible.
Yeah. Well, I guess both your injectors, but also your patients, they're probably consuming the same stuff that we're consuming here in Australia. Instagram, TikTok, you got the plastic surgeons, causing a bit of hype about filler anxiety and how it's terrible and how you should never do a biostimulator. And I'm assuming you see all those sorts of questions that we're encountering.
That's correct. And you know what? And it's like surgeons got a surgeon, right? Yeah. And sometimes, they want to fear monger, so the patients end up doing surgery, but there are surgeons out there that will stop the BS and say, no, it's really not like that. You can actually use these products judiciously and not interfere with future facelifts.
Yeah. So when it comes to facial aesthetics, spinning away from PRP for a sec.
No pun intended, yeah.
Yeah. Yeah, exactly. How did you learn? I mean, did you do a basic course? Did you do an apprenticeship or a mentorship under someone? What was your journey into understanding, Botox and fillers?
So after the course with Dr. Runnels, I came across Empire Medical Training. They're based in the United States, and they have your basic courses, but the class sizes can be pretty large, anywhere from like 15 to 40, and you're hands-on as you just like kind of form this chain. They give you a little bit of product to inject, and that's your hands-on.
Wow.
And I loved it in the sense that it was kind of like a poo-poo platter of aesthetics. You get, you buy it, you buy into the program, you get to see a little bit of everything, right? But it's not enough, to be a well-polished aesthetic physician. So I looked locally for smaller class sizes, and a friend of mine, colleague, Dr. Amir Rosati, was my first, trainer where it was more intimate. It was supposed to be a setting of 3 injectors, but that day it was just 2 of us. So I got a lot of hands-on experience with that. And then also just like day to day, I'm constantly injecting. I'm doing nerve blocks, epidurals, joint injections. So it was very easy for me in terms of the, hand-eye coordination and just the background in anesthesiology. And then also getting the patients nice and comfortable. I bring that to the table. So I do lots of nerve blocks, particularly, in notoriously painful areas. So.
Okay. And so what does your practice look like today in terms of, the profile of the patients that come in? How do you kind of, mix between, some of the more, functional treatments that we're going to get into and aesthetics, and just give us a flavor of your practice.
The bulk of it now is penile augmentation, all right? But if we exclude that and what's left in terms of facial aesthetics, it's really just the injectables, your neurotoxins and fillers. I partnered up with estheticians downtown, and they run the laser service. So they're actually more skilled at that than me. I'm their medical director, and I dabble in it a little bit, but I just hand the patients over to them. They are Chinese, and they're pretty well connected with the Chinese community in Toronto. So there's always lots of patients that are following the trends in South Korea. So it allows me to be a little bit more experimental, right? So I was doing temple reflation and even like forehead filler for like the longest time after taking a cadaver course and understanding the anatomy. But they let me, kind of go to town. And things like calf slimming using neurotoxin, right? Not a lot of people have heard about that. And, I got to practice on these patients, but there's a little bit of experimentation, but however, they're consented and they're aware that, there's certain risks that go along with this. I know you're looking for an aesthetic outcome, but we're affecting muscles, and you may not be able to wear high heels or so, or you may stumble, but we're going to do this as safely as possible. We'll do like the smallest dose, and then we can always top up on it to get our desired results. That's the one end of my aesthetic practice, and the other, it started off correcting or treating erectile dysfunction. All right, and I don't do that quite so much anymore. It's more of the aesthetics, and that's just the way things happened.
So do your male sexual aesthetic or sexual functional patients also blend into the facial aesthetic side, or they're pretty separate demographics?
There's crossover. It's like, while I'm here, can you fix this?
Yeah.
I was like, yeah, absolutely. It's one-stop shopping. Oh, and then my shoulder hurts. Hey, I do PRP. I can treat that.
So how do you kind of promote yourself from a marketing perspective? Because it's very hard to get multiple messages across. You kind of get known for something. It's a competitive landscape. So how do you approach that?
Yeah. So this is the challenge in Canada, because I, as a doctor, am not allowed to advertise, right? And
At all?
And no, I mean, like, kind of indirectly. Right. There are certain loopholes. Okay, for example, most patients find me through Instagram, and it feeds off to my Facebook. So they'll find out what I do there, but I cannot email blast. I cannot stuff flyers or even put pamphlets in the pain management clinic advertising penile augmentation, because the college forbids you to advertise for something that patients aren't looking for directly, right? However, there's something called fallow boards, and it's dedicated to penile augmentation. I'm a sponsor there, so I can actually advertise there because the patients are specifically looking for penile augmentation, so I can advertise there. But I can't advertise on the radio as Dr. Leonardo. I'm, a pioneer in sexual aesthetics. I'm the first one doing penile neurotoxin for shrinkage. I can't say any of that, but it's on my Instagram and people get it.
So presumably you can say what you like on your Instagram, which, let's be honest, that's where most patients are now looking, right? They're either on Google or social media.
That's correct.
Right, so you kind of can. There's just certain things that you can't do, which is way better than here in
with,
Australia.
With limitations.
Yeah, okay, fair enough. And what do you like to do outside of aesthetics? I mean, you're obviously a husband, you've got kids. How old are your kids?
They're 13.
And
they're twins, boy and a girl.
And do you find the time to have any hobbies? What do you do outside of work?
Oh my God, I'm like so cruel to my body. I used to play basketball until I couldn't run up and down the court anymore, tennis, and then also softball. And while I was in Australia taking surfing lessons, I injured my shoulder. And I had it PRP'd about 10 days ago. Because the range of motion is pretty bad, and I have to get in shape for tennis and softball season.
Right.
So there's that. I like to travel a lot, especially with the kids, because we're American. I mean, we're dual citizens now, all right? But we travel back and forth into the United States, and then we went to Europe last year. And Australia was a big trip this year. Like to do that. And then for me, concerts. You can usually find me in a concert at least once a month. I think the last couple of years I averaged about 30 shows. And some of these are general admission where if doors are open at 7, I'm there at like 4 p.m. or 2 p.m. depending on the act because I want to be front and center, right underneath the artist's nose.
Wow.
What sort of concerts or music do you like?
When I was a DJ, it was mostly electronic, so new wave, and then it kind of morphed into house, acid house, and then techno. And then at techno, I just kind of stopped. I kind of got bored with it.
Okay.
And then so the bands that I'm seeing now are usually like the more underground. They're electronic. It's kind of like punk, but with keyboards.
Okay.
Right. It's called electronic body music, EBM. A lot of the music came from Belgium and also London, right? I'm planning to go to London in August. But those are lesser known bands, and those are the general admission shows. And I'd rather pay like $50-$60 and like do my time in line just to be in front, as opposed to spending a fortune for like an arena show being, front and center.
Yeah, fair.
And but I like pop music as well.
Cool.
So tell us a bit more about your clinic. Like, what's it called? What does a typical week look like for you? What's your split between, traditional like facial aesthetics and, sexual aesthetics or, and the functional stuff as well?
All right. So I'm still working in pain management. So I devote 3 days, Tuesdays, Wednesdays, Thursdays. And when I'm not there, I'm doing the aesthetics. So it's almost like I have 2 full-time jobs. So sometimes, like Wednesdays and Thursdays, I may finish pain in Brampton, and then I drive all the way downtown. I give myself an hour and a half between cases, and then I'll do the aesthetic cases there. So most of it right now, I would say like 80% of it is male sexual aesthetics. Okay, and then the other 20%, it's your typical, anti-wrinkle treatment, or facial optimization, Sculptra, Radiesse. Not so much the PRP anymore. We have Exosomes, PDRN, etc. And I just find that it's just easier. And I can't really appreciate the difference between a vampire facial with PRP versus microneedling with PDRN or Exosomes. I really can't, and it's just easier that way. And then the estheticians are able to do that. So it's just kind of out of my hands.
Yeah. Okay, that's quite refreshing because, I mean, I've played with PRP years ago and I still don't fully understand it, if I'm completely honest, but I was underwhelmed. There are some people who absolutely love it. They swear by it. But then you speak to some of the providers of the devices, the centrifuges, and even their science seems to be completely different. And they'll argue, you know, at conferences about which one's better, double spin, single spin, all the things that you mentioned. So, yeah, I don't know. I think the jury's out still for me. What do you think? You've had PRP?
Yeah, but again, I don't know because I've tried everything, so I don't know what's working. It's it's sort of like, you know, when you're putting so many ingredients into the meal, it's hard to know exactly what's making it taste good. So
yeah,
I don't know. I mean, I hear things around, you know, exosomes as well. I mean, people are sort of not really sold on that either. You know, apparently, you know, the science behind that's, you know, minimal in terms of, you know, studies that are very convincing and, you know, with large groups. So I mean, what's your experience like with exosomes? Because that seems to be questionable in some people's minds.
Well, I use it with my PRP for hair growth. And with exosomes, again, it's a series of 3. And I don't really know if it's helping my PRP, but you know what? I'm sticking with the winner. I'm attributing most of the success to the PRP. But, you know, if you have the exosomes on board, then more power to it. All right. So, like, if you actually look at my Instagram in terms of my hair posts, you'll see, like, you know, this is PRP after 1 session, after 9 months. And you know, there's a big wow factor. Often on these Instagrams, I see providers injecting PRP. We're offering the service, and then you never see before and after photos because I'm sure they suck, right? And but I'm always throwing mine out there. I have this new device, DEP, dermoelectroporation. No needles. Somehow it sends an electric current and opens up channels in the skin to allow for needleless delivery of your medication. So I'm delivering PRP and also platelet-derived growth factor in combination with exosomes, and I'm getting pretty fantastic results as well. And I believe it's going to be a one-and-done approach, just because at about 9 months or so, I don't feel the need to repeat this as well.
That's interesting because a lot of people would attribute the results of PRP just to the needling or you know, something else. So if you're doing it without needling and getting results, then that does suggest that there is something in the PRP or the exosome or whatever you're putting in rather than, you know, the mechanical trauma.
Correct.
That's quite exciting. We have to share results of that later. Now, how do you run your clinic? Are you on your own? Do you have other people there? Do you have staff? Do you have a receptionist? Like, a lot of people struggle with this stuff, especially when they're doing traditional medicine still or traditional nursing. So how do you run your own life?
So it changed with the move to downtown. So before, when I was in Etobicoke and then also I was in Mississauga at one point, it was all me. And when I was starting, like, I would answer the phones, I would answer the emails, and it was just so exhausting. Yeah. And once I started getting busier, my husband took over as office manager, where he answers the phone. He's like the patient coordinator. He's a pharmacist. His license didn't transfer over to Canada, and he was kind of like stay-at-home dad until my practice really started booming. And patients absolutely love him. He's great with them. So it's been the two of us. And in Etobicoke, it was a weird situation because I was renting a room and I only had one fob to enter the building. So it made staffing very difficult, right? Because someone has to have the fob. It's like, why don't I have a second fob? And it was always a point of contention. So I was a one-man show, and it just wore thin after a while. Right, I'm wiping I'm still wiping tables and cleaning things, etc. It's not very glamorous, but I was a one-man show. So when I moved downtown, I partnered with the two estheticians. They have two other locations in the city, but I'm not co-owners with them. I just provided the injectable service at their laser clinic. So this time it's a partnership. So now, you know, other people man the desk. They let people in. I don't have to break scrub to answer the door, things like that, right? And they have clients that can refer to me directly, right? Where before, if I just happened to be there, which was once in a blue moon, I could do like a quick curbside consultation. But now that I'm there, on designated days, I'm there and I can see a lot more of their patients that they refer over to me.
Over the last couple of years, we've seen a lot of media hype negatively portraying HA fillers, and we all know that the fillers last longer than what we all thought they would. So have you experienced the same downturn in the amount of filler volume, and how's that impacted your practice?
I still buy a lot of HA and Radiesse because those are my key ingredients for penile augmentation. Right? And you still need HA filler for lips. A lot of Sculptra, a lot of Radiesse, but there's certain areas I wouldn't want to inject Radiesse, maybe Sculptra or HA filler, right? Like the piriform aperture, or even the temples, the forehead. So there's still need for the HA fillers in my practice, and I love contouring with it, particularly cheekbones, mandible, chin, immediate gratification. You can't get that from Sculptra. You can get that from Radiesse, but some people don't want Radiesse. But there's still a big role in my practice with HA fillers, except that I prefer to inject it deep because I just feel like the bone sets the tone, right? And the issue is the tissue. If you inject a little bit too superficially, sometimes it can weigh down the skin. All right, but however, if you're really kind of reinforce the bony structures, I think you're going to get more bang for the buck.
Yeah, I did a masterclass this weekend with Tom Van Eyck, and he explains in his practice that he either injects dermal filler in the dermis, like very superficially, or on the bone. He doesn't believe it should live anywhere in the middle.
In between.
Yeah.
Correct. And, that's how I am too.
Yeah, you see a lot of the problems with nodules, a lot of the ultrasound work that some of the ultrasound gurus have done, it's because the filler's sat in the muscle and it's kind of in the wrong layer, and an area that moves a lot, it seems to irritate either the immune system or the filler or both, and that's where a lot of problems seem to be coming from.
Yeah, and then speaking of Tom Van Eyck, the Fern technique, you have to have HA filler for that. And I did a Proceris crease like two nights ago, and I used a high G prime filler, to just give the dorsum a little bit more of a ridge. And then I injected superficially with Bellatero Balance, kind of like a pseudo Fern technique, but also blanching to really fill in that crease. And it turned out beautifully. And, you need the HA for that.
Yeah, I think we can all agree that we still need HA, just using it better. So how do you explain this filler anxiety and what's being discussed on social media with the surgeons, etc., to your patients? This is something that injectors really are struggling with at the moment. I probably have this chat at least 3 times a day with people. So how do you do it?
I don't know. It's just so funny because when the patient comes in, it's like, I want to look natural. Oh, because you asked, I'm not going to make you look really artificial and like alien-like. Thank you. All right, now that we have that clarified, right? But like, I showed them my body of work. All right, this is what I produce. It's kind of that undetectable, but you know there's something there. There's improvement, but it's kind of like you, only better. That's like the motto. But yeah, they're just terrified about looking alien, like with the big lips, etc.
Yeah, I think the patient's perception is both, set by what they're seeing on Instagram, but also sometimes it's just wrong. Like they'll often say, "Oh, I don't want to look like this," and they do this weird face, and you're like, "Well, of course not. I don't want you to look like that either." So we're on the same page here. But their perception of what we offer is sometimes warped. Mm-hmm. But they do see weird results online as well. So it's a bit of both. It's real and myth.
Well, you'll only notice something that looks unnatural, probably. So it's kind of like, unfortunately, that's what people are the untrained eye gets exposed to the bad work.
Yeah, it's and I also tell them it's going to take a lot of filler to make you look that ugly, right? We're only talking about 1 to 5 syringes.
Yeah,
all right.
That's a good point. So are there any products or techniques or things like that in aesthetics that you think are bullshit? So we've had lots of people who have, argued for and against lifting threads. That was something that was sort of common on our Injector Diaries years ago. But what do you think's not quite worth the juice?
On board with the PDO threads, I was one of the first providers in Canada doing that, one of the first ones to stop, just because it was so hit or miss. And sometimes I'd have to save the work with filler. So was it the threads or was it really the filler? But now in Canada, we have something called Aptos, and I think it's giving great results. And it's very promising. I've only had a couple patients so far, and I'm still really trying to figure it out. But in terms of other things that are pertinent, like the PDRN, the exosomes, the PRP, it's being thrown around a lot, and I just really don't know what the difference is between them. We have them available to our customers, and sometimes it's just a matter of this patient is asking for this. Do we have it? I was like, sure, right? Do I believe in it? I don't know, right? So I think that's the big one right now. Regenerative aesthetics. Well, how much are we really regenerating? And what product works best? And it's kind of difficult to tell.
Yeah. Well, obviously with the hysteria around HAs, we've seen the rise or the re-emergence of the biostims, whether they be bioremodelers, biostimulators, bioregenerators. You sort of raise an interesting point, like what does it even mean? What are we actually regenerating? But you mentioned that you have Radiesse in Canada. Like, what else are you using? Like, how big are biostims as a category in your practice, and sort of how you're explaining it to your patients?
Pretty intelligent, and they've caught the wave. They're aware of regenerative aesthetics, and they asked for Sculptra and Radiesse by name now, which was quite a different story maybe about 5 years ago. And so they're more educated, I'd say, about that.
Do you think, and I don't know what you do, you said you use exosomes for hair, but I don't think you are using them for the face from what you're describing. But do you think it's ethical that an injector would say, sure, you can have something, I just don't know if it works? I mean, how do you think that sits ethically?
You're taught on day one, do no harm. All right, so are we harming them? No. If you microneedle the face, they're going to benefit regardless of whatever substrate you put on it. It could just be HA serum. There's evidence for exosomes, PDRN, etc. But I don't, if I did one face with PDRN and the other face with exosomes, am I going to be able to tell the difference? Probably not. And that's the problem. A lot of this is kind of qualitative and not quantitative. You can't put a number on it. So we're not doing harm. And if they get a nice glow out of it, so be it. Could we have gotten that glow with just HA serum? Maybe, maybe not. But yeah, I don't see a harm to it, just as long as there's science to back it up and the patient's happy.
Yeah. I mean, I don't know, going back to your pain management days or something that you're doing in traditional medicine, I just can't think of another analogy where there's some options available to you that you kind of go, let's just see what happens. I just can't think of an analogy in real medicine where we would do that. We would say it either works or it doesn't work, and let's just stick to evidence-based medicine.
Yeah, and then exosome for hair as well, but I just feel like it's the PRP that's the real workhorse. But I'm just throwing it in there because the science says it's good. But with exosomes, it's supposed to be a series of 3, but I don't do a series of 3, so how much is it really helping? But I'm getting great results, so I'm going to stick with it.
What do you think from the business side of things? I mean, if you're a clinic owner still, not that you are, but and your injectors were saying, hey, we want exosomes, we want PRP, we want all these things available in our cupboard, we're just not sure if they work.
Yeah, well, it would depend on the type of business that I've got. If it was a high volume clinic with low margins, probably I've got to be careful about having too wide of a selection of products, because then that starts to impact the amount of inventory I have to have on board. It impacts my ability to negotiate with suppliers, which then in turn can impact my profit. So depending on my type of practice, if you're saying I had more of a boutique practice, a bit more leeway, I mean, I probably wouldn't. I don't like being an early adopter of things like this. I'd probably wait until there was enough momentum and enough, I guess, demand coming from the patients before I stock it in my clinic. I think that being an early adopter is great, but maybe with a new iPhone, maybe not with a new product, where potentially there could be side effects. It could be things that we're not aware of yet, and it can just be sitting in your cupboard. And then also you've got the issue of patients demanding refunds, poor patient selection potentially. Yeah. I just don't like touching new stuff until it's proven and got a demand.
Yeah.
That's my general business perspective on it. Yeah.
Yeah, I'm pretty much like that. You guys don't have injectable polynucleotides yet, do you? The Radurans or other brands?
Injectable. They're supposed to be just topical at this point.
Interesting.
That's my understanding.
Yeah, so I think what's happening in North America, I don't know if it's launched in America yet, but you can buy Raduran, as in the injectable form, but because it's not FDA approved to inject yet, they're telling you to put it on topically, which is stupid, because those polynucleotides won't go into the skin. They're too big. So
The molecule?
Yeah, the molecule is just too big. So I mean, even there, I think injectors are not understanding the science, and yet they're happily offering it to patients because it sounds cool. Have you seen that, John?
I haven't personally.
Yeah.
It's like,
You just see on Instagram.
We're not going to name names, yeah.
Yeah, don't worry, we won't mention names. But anyway, I think what our bottom line is, understand the science, get comfortable with it. If you believe in it and you can back it, offer it, but don't if you can't do that.
So what's your sort of product of choice when it comes to HA fillers? I think you mentioned Belotero earlier in the discussion. Is that your go-to? Is that the
For the face, we'll come to penis.
Well, yeah, so for the face, if it's superficial and I'm chasing lines, Belotero Balance is very forgiving. It's meant to do that. But in terms of a workhorse, I like Restylane Classic. It has a high G prime, and I'm sure there are other high G prime products out there nowadays, like even Restylane Lift. But I just find that the versatility is amazing. You know, I can contour the cheeks with it, the chin, the mandible. You know, I can do, a liquid rhinoplasty with it. So it's kind of like my workhorse.
Okay. What about your favorite toxin? What's your number one?
Below the belt, it would be Dysport, right? Because it spreads very well. We want spread down there. For the face, I'm going to have to say Botox, even though Allergan hates me.
Yeah.
Why do they hate you?
You just gave them a free plug, I'm sure. Yeah.
But it's it's like Coke. It's the original, but for low-lying rhytids, it would be Xeomin, because I don't want it to spread too much, right? I want it to be a little bit more precise. But
Okay.
I think just Botox is perfectly fine, and I get great results with it.
So why are you not friends with Allergan? What happened? Tell us.
Because they don't
They don't like
that
your off-label use.
they don't like that I registered the name Grotox, all right?
Right.
And then and I'm trying to get Scrotox in Canada, and at one point I was doing tox for the clitoris and called it Otox, OHTOX. I could see where there's a problem with that, and I dropped it because I don't really have too many female clients asking for that. But they sent their legal team after me saying cease and desist, blah, blah, blah. I changed my website because originally I was exclusively Allergan. So I had mentions of Botox and Juvederm because I was using those products. But as the years progress, I kind of let my website just age while I'm using other things. And they were like, you're not even a client of ours. I was like, I just bought some product last year. What are you talking about? Not a lot, but I still have an account. And then they kind of they cut my account, right? But I'm still able to get Botox because I'm medical director for a facility, and I'm just kind of under the radar. but it's just why can't you work with me? Because MERS and Galderma love that I'm using their product. Because if I'm doing penile neurotoxin, sometimes I'm using 3 vials. All right, it sounds crazy, but I'm using a lot of toxin. And if Allergan were on board with me, and other people were using it, then their sales would just skyrocket if they're doing this. But instead, they're telling me, "Oh no, this is completely off label, and we don't agree with you." I was like, "Okay, whatever."
Fair enough. Okay. So Biostims, Radiesse, what else are you using?
A lot of people are like, is it one or the other? I don't think they're really in competition with each other. I use them for different reasons. All right. So if there's global volumization, I'm going for Sculptra. All right, because several different areas that you can address. And if it's high risk, I'm going with Sculptra. I'm not putting Radiesse in the piriform aperture or in the temples. and I feel comfortable with Sculptra because it's mostly water. Okay, and then in terms of Radiesse, I actually like it better as a skin treatment, just because the science shows that it stimulates collagen types 1, 3, and elastin better than Sculptra. So I like Sculptra deep, and I like dilute Radiesse more superficial as a skin treatment.
Okay, I was going to ask you about how you use Sculptra, because we had Shino Bay on, very well-known user of Sculptra, trainer, and he does his differently to how we're taught around the rest of the world. So is that who you learned from?
Yeah, so I use his technique. I've attended lots of Galderma, conferences, and diluting it to 10 cc's and doing it superficially, and I was like, I can do that as well. That's fine. So the patient has a preference for one or the other. It's like, that's fine. I'm not going to arm wrestle you about what you should use.
Okay, so if someone's globally deplete, like you said, and you're going to choose Sculptra, why do you then go down on bone, not into the soft tissues?
Right. So a lot of the times, the facial aging is from just bone loss as a part of age-related changes. Right. So that's where the money is. Why do you rob a bank? Because that's where the money is. Right. So if the aging happens in the bone, then I want to really fortify and reinforce the bony structures. And there are fibroblasts on the periosteum, and apparently they communicate with the fibroblasts in the dermis. So you get 2 for 1, right? You still get that Sculptra glow.
Yeah, fair. I have to say I've never done it that way, but I'm keen to learn and do something a bit different.
There you go. If you need a crash test dummy, let me know.
You've had enough.
So what about like sort of skin quality? Some of you got your skin booster products. Do you sort of dabble in that area as well?
Just because like you're injecting the entire face, they're going to bruise, and it's uncomfortable, and it's like you could probably get the same result if you just kind of microneedled. I'm just not a fan of like the multiple injections throughout the face. The estheticians I work with, they love skin boosters, and they have like a meso gun that'll do it. It's like, all right, you guys do it.
Yeah, interesting. I have to say, when they first came on the scene, I was actually at your clinic years ago. They called it microfiller.
Oh yeah.
And you guys had the gun thing.
Yeah.
And I have to say, at that point, I was like, nah, this is too silly, and similar sort of argument to what you just said, John. But there's a few more products on the market now. We've got SkinV from Allergan, and obviously Profilo, and other things have come on the market, which was Sunakos launched last week. And I do think that patients really value that sort of icing on the cake type treatment, where they do see a bit more, they're not looking for volume or shape, but it's just, better skin, plumper skin, firmer skin, hydrated skin. It can set apart a treatment, but it's a little bit hit and miss as to which is the right patient to choose it for. But I don't know what products you have in Canada.
But I don't really dabble in Allergan anymore.
Okay.
Galderma has Vital and Vital Light as their skin boosters. Redensity 1 is a good skin booster. Again, I don't really participate in those treatments. Like for me personally, in terms of getting a nice skin glow, I'm using a topical product called CO2 Lift. I absolutely love it. It's just, it hydrates. It does everything skin boosters are supposed to do. It improves circulation, and I get a nice glow out of it. And I don't have to inject the face, and there's no downtime. So that's my go-to.
Right. Okay. Cool. Fair enough.
Should we talk about penises?
Yeah. Not yours. So male sexual aesthetics, let's just define the term and the 4 or 5 things that you're offering people. What do you actually mean by that term?
This is about, aesthetics for the male genitals, whether it's the penis or scrotum, and then also the rectum, all right? That counts. So the rectum, it's not really aesthetics. It's more functional in terms of relaxation. But for the penis and the scrotum, we can enlarge these, to give you a little bit of a boost in confidence, right? Because we're going to make it bigger. So a lot of guys come to me with a little bit of shame and embarrassment about how they are and how they look with their peers. So it's a way to really enhance them, to give them a little bit more confidence, right? We can use tox and fillers to do all sorts of magic. With the tox, we can create relaxation. so that the penis hangs lower in the flaccid state. Same thing with the scrotum. And then in terms of filling, we can improve or increase the girth of the penis. And then same thing with the scrotum. Okay, so that's what I bring to the table.
I mean, David sort of joked on that sort of interlude, and maybe there's a taboo or a bit of a sort of a joke about male sexual aesthetics, but when you think about it, women are having
absolutely
implants for their breasts, and they're having labiaplasties, so there's nothing different about it. I just think it's still seen as, I don't know, silly for some reason. I don't know why. What are your thoughts?
Well, I think that if you look at the overall percentage of males having aesthetic treatments compared to females, it's still like probably around 10% or less in most parts of the world. So you're already talking about a smaller cohort of patients. And then you've also got, and why is that? Because there's probably still a significant stigma for men wanting to beautify themselves. It might be seen as less masculine, maybe being too vain, maybe women don't want guys overly manicured. And then you sort of multiply that with, well, now we're going in to make your genitals more attractive. I think it's the combination of, it's kind of an unusual area, plus we're dealing with the males who are a smaller part of the industry who are still not, it's not fully 50-50 yet. So I think it's probably both those factors, but keen to see what you think, John.
When people find out what I do, there's always like a giggle or so. It's kind of like a joke, or it's not taken seriously as an aesthetic provider, right? I mean, anybody can stuff the penis with filler, but to make it look natural, feel natural, and give the patient a sense of like pride. A lot of times they're embarrassed, and now it's like, oh wow, it's like I don't have to be ashamed anymore. That's absolutely magical. And even though it's 10% of the market, my practice, it's like 90% male, right? And this is a lucrative business. So even though it's 10%, if I'm filling my day with maybe 2 or 3 augmentations, that's going to be more profitable than a full day of chasing wrinkles and filling lips, right? And it's just really transformed my practice in such that I have more time to do things, right? And I don't have to, overlap, patients just to break even or so, all right?
Yeah. So how do I word this? How big is the problem? Like, how many men suffer with what they perceive to be, size issues or I guess functional issues? Like, are we just not aware of it? Is there a bigger issue that you're seeing?
I think the patients that I get that are really, that have the chip on their shoulders, where they're really ashamed, I think it's actually maybe only like 20%. Most guys come there because they want to spice things up in the bedroom, and they just want to be bigger, like the women who just want a bigger chest, bigger boobs, right, to feel sexy. And that's the majority of my patients. They're from anywhere from 35 to maybe 55, 60-ish. They have the budget and they have a sex life, and they just. I think deep down inside, I think most of us want to be kind of like that porn star in bed, right? And I think that's the majority of like my patients, right? They want that. They want that confidence.
Yeah, I'm curious to know. Like, are these guys, like you said, they just want to enhance and they're happy in themselves, or is there some sort of mental or body dysphoria or a real micro penis kind of thing going on?
I had a consultation a couple of nights ago, and this patient was really challenging because by the time you see me in consultation, we've given you a lot of information through email. You've researched me through my Instagram, my YouTube, my website, etc. So when you pay the $150 to see me in consultation, it's pretty much a formality, gauging my personality. But this patient, he just had all these questions and doubts. And I was like, I don't mind questions, but each of your question is a doubt. I don't understand why you're here, right? Like, he wanted to guarantee the appearance, the longevity. It's like, I can't give you any of that, all right? And I just can't. It's like, you've seen my work. You've seen my gallery photos. Like, yes. It's like, do you have another set? It's like, no. I don't have the shitty penile augmentation gallery because they're all pretty good, Like, I'm not cherry picking my work, And like, if you want to look at the guy who I did last night, like this is his before and after. He had a botched procedure, and I made it look more presentable, right? But I asked him, you know what? Are you ashamed of your penis? Right? Deep down, is that what's going on? And he's like, yes, I'm really self-conscious about it. I said, you know what? A lot of men would be happy to have your penis in terms of the size and the girth. All right? There's always going to be someone bigger than you, and there's always going to be someone smaller than you. You know, and I put his penis into perspective, and he was actually on the larger side of average, right? So traditionally, we all thought 6 inches erect was average, but that was based on the Kinsey report in the 80s, where it was self-measurement, and the guys added an extra inch, right? Even though it was anonymous, they added an extra inch. And then maybe about 10 years ago, they had something more standardized and directing the measurements, and it turned out it was about 5 inches. So if you look at the Gaussian curve, 90% of gentlemen are going to be between 4 and 6 inches erect, all right? And I think the problem is guys don't have a great sample size in terms of seeing other erect men, with the exception of pornography, where they're hand-selected, you know, for their size. They're long, they're thick, right? And that's what their comparison is. But there's also a phenomenon known as locker room syndrome, where guys are actually more self-conscious around their buddies in the locker room situation, as opposed to with their partners who see them erect, right? They see the potential, you know, they go from potential to erect, and this is what they're offering, this is what they're bringing to the table. But in the locker room, you're flaccid, you've got some shrinkage going on, and you're being judged by that, right? And that's how I developed Grow Talks, you know, talks for growers. It's to turn these growers into showers, to create relaxation.
Okay. And is it a 50-50 split, would you say, between like straight and gay men that are coming to see you, or is it predominantly one or the other?
I don't know, and I don't really ask. Okay. A lot of times patients will just volunteer that information. But my guess is that in my practice, it's 90% straight, 10% gay.
Oh, wow. Okay.
And, you know,
interesting.
I don't care what the split is, just as long as, you know, they come to me and I give them, you know, a great result, then I'm happy, they're happy. But like with this one gentleman last week, I thought like maybe he's gay, and then he mentioned his wife. I was like, see, like I'm bad with that, but I don't care.
Yeah.
Your gaydar's not very good then.
It's terrible.
I mean, do you think it helps that you're a male? You know, you're gay. Like, do you think it makes the consultation easier? I mean, I can't imagine a guy would go to a female to do this. Maybe. I'm sure there's people out there.
I've trained female providers, but I think most guys would want a guy to do it. All right.
Yeah.
But also, the provider has to know what a good-looking penis looks like, right? That could be a woman, that could be a gay man, that could be a straight man, all right? It's the aesthetic eye. I've corrected a lot of work from people you think would do great work, like plastic surgeons, urologists, aesthetic physicians. It's like, I can't believe this is walking through my door, and they did this, and like I want to dissolve it all and correct it.
This is his dad. I can read his dad joke. He was going to say, "Are those cock-ups?"
Yeah, exactly what I was going to say. Exactly.
I guess so.
Yeah, there you go.
There you go, telepathy. Well, if this kind of mini sort of interlude into male sexual aesthetics has got your appetites whetted, we're going to go into a full episode of this in a masterclass.
Yes.
We're going to record this straight after this, so look out for that next episode. But I guess just to wrap up this Injector Diaries question, how do you think we should use social media? I mean, you said that you're doing most of your advertising on social media, so you know everyone struggles with it. Everyone finds it the bane of their life. They don't want to record content and so on. How do you do it?
Yeah, so I'm my own social media guy, all right, and it's exhausting, and you know it has to be truthful. Right? I see a lot of people cheating out there in terms of more favorable lighting for the after, right? Look at this before and after. And it's like, oh, come on. This is like the oldest trick in the book, right? Where you have like lighting above for the before, you have all these shadows, and then you've got this ring light, or they're in a different room. It's just like, you got to be honest, right? And then be careful with your claims. That's the most important thing. And then like there's this push to be entertaining, to dance, whatever, and to be comical. And unfortunately, that's what sells. And there are some providers out there that just do that beautifully. The marriage of like great content, being entertaining, and more power to them. And I look up to them, and I wish my posts could live up to that, right? But all the dancing, etc., doesn't make up for bad work.
Yeah, you can't dance away an occlusion. So, unfortunately,
Maybe you can.
Okay.
We'll do a controlled trial and see.
Exactly. So, what do you think the future looks like? Maybe if we were to crystal ball gaze 10 years from now, the industry itself. What are your thoughts?
So right now, tech is on the rise in terms of ultrasound imaging, and I'm kind of like halfway in and out. I do a lot of ultrasound imaging and fluoroscopy in my pain management practice, and then part of me is like old school, like I didn't need an ultrasound to inject the temples, or the piriform aperture, and then like since I'm training it, like back of my mind, I'm like, oh my god, let me take a quick peek here, like oh my god, wow, that artery is not where it's supposed to be. Whew, luckily I have this. Like I've never doubted myself for putting the ultrasound probe down, right? And to have that reassurance. And whether or not, it should be more standard practice or mandatory, that's debatable. So, yeah.
Elon Musk made a prediction a few days ago that robots will be better at surgery than surgeons within the next 3 to 4 years. Do you think that he's maybe being ambitious, or can you see that potentially being a possibility? I've learned not to doubt Elon. Every time I thought he was wrong.
I actually see it kind of happening. Like even like 5 years ago with FUE, there's an FUE robot that's doing hair transplant, right? And it's absolutely amazing. Because I had thought about doing that, and I was just like, on second thought, this is just really tedious, right? And I was like, my neck, my back, my hands are not going to be able to tolerate this, but more power to that robot. Go ahead and do it.
Yeah. Well, I think with Elon, he's probably right. It's probably a bit too premature. Often he's too early with his predictions, but they eventually come true.
Well, even if it was technically possible, is the population ready for that yet? Maybe
even just the infrastructure of hospitals, and it's not just the robot; it's everything around it. So I reckon closer to 10, but it definitely happen.
Yeah,
I'm telling you.
There you go.
Right, we always finish our Injector Diaries episodes with a question left by our last guest, and then you're going to leave a question for our next Injector Diaries guest.
And this guest was also at the CAMA conference where we met you.
Yes.
John.
So I don't know if you know Dr. Stephen Saw. Do you know Stephen?
Yeah. He's a buddy of
Fine,
mine. Wasn't he already on?
Yeah, he was.
Yeah.
He left this for you.
So he left this for you. He didn't know it was going to be you.
He actually recorded this at CAMAs. Yeah.
Yeah. So the question was, what's the most important therapy for longevity, in your opinion?
Ooh, for longevity.
I'm guessing not exosomes.
You know what it is? And the patients don't want to hear it, but it's diet and exercise. Seriously, it's like if everyone was more diligent about their intake, what they're putting in their bodies, and getting exercise, I think we would all age a lot better. We would feel a lot better. All right. However, there are extremes where we're losing way too much weight and we look emaciated, kind of like that Ozempic face. And that's where our role is in terms of aesthetic physicians. But even with like erectile dysfunction, in a perfect world, diet and exercise could probably give you much better erections. But until you get your shit together, all right, I'm offering you these pills and these injections.
Yeah, fair enough.
Good, sensible.
Now, your turn to leave our next Injector Diaries guest a question. So what is your teaser for them?
Kind of touched on this already, but you asked me, it was basically, what's technology's role in this? And I was going to ask about, well, how do you see the role of ultrasound in aesthetic medicine? But I gave my answer to that. But I'm curious to see if the next guest is dabbling in it or really proficient, and if not, if they're going to get into it.
Okay.
Excellent.
Fair enough. Well, John, thank you. The audience won't know this. We had some massive technical hitches in the middle of this episode. Thank you for being patient with us, and the network gods are back on our side.
Thank you.
But let us know when you're next going to be in Australia. I know you've obviously just been recently, but you said you're going to come back, so let us know, and we'll try and actually meet you this time rather than doing it through Zoom.
I know, but like our schedules just did not match, and the day I could go to the studio, that's when I was leaving for back home. And I know that you're away celebrating an anniversary or a birthday or so.
Yeah.
Okay.
But anyway, we'll catch up next time for sure. But thanks again. And our audience will see you in our next episode, which is our masterclass on male sexual aesthetics.
Thanks, John.
Awesome. Take care, John. Bye-bye.
Thanks, John.
We hope you enjoyed that episode, guys. To stay up to date with our latest news and episodes, follow us on Instagram, and we're now on TikTok.
You can also now watch our full video episodes on YouTube and Spotify. So if you like what we do, please give us a like and subscribe. Please also consider joining our Patreon for invaluable business and injectable education. Get access to our global community of like-minded professionals, hints and tips videos, bonus podcast content, and more.
All of our social links, Patreon, and contact information are in the show notes below, and we'll see you in the next episode.